On 21st July 2021, 84 Hiroshima Black Rain survivors got a groundbreaking victory at Hiroshima High Court. The court ordered government to designate Black Rain survivors as official hibakusha and provide state health care like other hibakusha. The government ignored their suffering for 76 years and excluding them from its aid regime set up in 1957. The Liaison Council of Black Rain survivors groups petitioned local and central government for more than 30 years and finally appealed to the court in 2015. It took 6 years to win. This is too long for elderly plaintiffs. 19 passed away during the trial, but this victory will save estimated 13,000 survivors in Hiroshima, other than plaintiffs. It is certainly great local news, but I think its implications are also global. Here, I explain how Black Rain survivors have been excluded from the state aid regime and how their experience was denied for half a century. Then I discuss the meaning of this achievement and its possible global impacts. The atomic bomb medical treatment law was enacted in 1957. This was the first state legislation supporting atomic bomb survivors. Without any state help for more than a decade, many survivors were trapped in the vicious circle of deteriorating health and serious poverty. They also had to live with constant anxiety and the shadow of death. Knowing this predicament, local doctors started to petition for state support along with the Hiroshima city government. The movement to ban nuclear bombs triggered by the bikini testing also created a national tide demanding registration to save survivors. The medical law provided state medical service for survivors who had radiation-related illnesses. But importantly, it also provided free medical checkups to survivors who had not yet developed any radiation-related illness. It aimed for early detection and rapid cure. This expresses the very principle of the law to eliminate the fear of the hibakusha. The court decision this year rightly recalled this principle and demanded that the government follow this spirit. The target of the medical law was hibakusha, defined and classified into 4 categories. These were carried on into the atomic bomb survivors support law enacted in 1995. Category 1, direct hibakusha. Category 2, entering the city hibakusha. Category 3, those exposed to radiation but not in the above 2 categories. Category 4, children in the womb. The third category is intentionally ambiguous. Lawmakers primarily thought of survivors who took part in rescue activities or disposed of the dead. However, they also assumed other possible cases which they had not even thought about, with very limited scientific knowledge about radiation. The court this year judged the Black Rain survivors should be in this third category. Then why did the government forget about the spirit of the law and wrongly underutilize the third category for such a long time? Despite its good principle, the medical law disappointed many in the beginning because of its very limited services for a small number of beneficiaries. Local governments and doctors strongly petitioned. Their efforts resulted in a new law in 1968 and revising the medical law 6 times until 1976. The state expanded designated areas and increased expenditure for the aid regime about 250 times in 20 years. This attitude, however, dramatically changed in the late 70s. In 1980, the government declared that it would never expand the designated area without scientific and rational evidence. The Reason Council petitioned, but all were rejected as unscientific. Then what is the government science to reject the survivors' realities? The government science officially recognized two sources of radiation which caused tangible health damage on hibakusha. The main one is the initial radiation emitted in the air within a minute of the explosion. The other is induced radiation, in which neutron rays interacted with such elements as the nuclei of soil. In both sources, its science only considers external exposure, and hence the amount of radiation is the key to defining its health effect. On the other hand, the government has consistently denied the health effect of the fallout, so-called ashes of death. U.S. Army official Thomas Farrell said in 1945, Hiroshima atomic bomb was burst so high up in the air that no radiation exists in Hiroshima. Surprisingly, the government expert in this Black Rain trial argued the same until today and rejected any possible health effect of the fallout because its very low dose could have done no harm through external exposure. The plaintiffs argue totally the opposite. They testify the fallout poured down on a very wide area, reaching 30 kilometers from the hypocenter, and most plaintiffs had developed radiation-related illnesses, including even acute symptoms. Lawyers and scientists supported them by explaining the mechanism of spreading black rain areas and argued the health effect of internal exposure by air and food, and even with a tiny dose. The court accepted the plaintiff's claim and rejected the government's so-called science. The Japanese government accepted court judgment on 29th July, but the next day, the prime minister issued a strange comment against the judgment. Quote, "The government cannot admit health effect of internal exposure regardless of the scientific dose estimation, because this is contradictory to the philosophy of the hibakusha aid regime," unquote. This could not disturb the court decision, but showed the government's predicament. The initial exposure and low dose effect not only contradict its aid regime, but was also quite inconvenient for the whole national nuclear policy, including energy and deterrence. Both are also pillars of the NPT regime, which the Japanese government ratified in 1976 and has been deeply committed to since then. Moreover, recognition of low dose effects from internal exposure logically discredited Japan's authoritative hibakusha data, namely the lifespan study. It's more than 16 years of epistemological study targeting 120,000 subjects, including 94,000 hibakusha. This data has been utilized for setting radiation protection standards around the world. However, its research design itself ignored low-dose radiation and internal exposure, underestimating those risks. This court case made clear that this data cannot protect people from risk of low-dose radiation. The global impact of this judgment could be huge. Now the Japanese government has two choices of abandoning the precious hibakusha data or reorganizing it into a more reasonable one. Of course, I hope for the latter. We need a more scientific and rational radiation protection regime to ensure rights and dignity of nuclear survivors, and also prevent more nuclear victims around the world. Thanks for listening.